I will first be palpating the anterior superior iliac spine, also known as the ASIS. I will stand anteriorly to the patient and place my hands on his hips. Where the thumbs naturally lie, that is where the ASIS is located. From the ASIS, if I move my fingers 3 inches up, I will be at the widest part of the crest, and this is where the iliac tubercle is located. From the ASIS to the umbilicus, the 1/3 up is the McBurney's point. This is where the appendix is located. If the patient suffers from appendicitis, he will feel pain. I'm going to be palpating the femoral triangle. I'm going to have the patient lying supine, and I'm going to place them in the favored position, which is a triangle. The femoral triangle is first composed of the inguinal ligament, which runs from the ASIS and the pubic tubercles. Then medially is the adductor longus pectineus muscle. Laterally, you will find the sartorius. Running through the triangle is the femoral artery, nerve, and vein, and the lymph nodes.
I will be palpating the ischial tuberosity. To do this, you can have the patient either standing with the knee on the table or laying on their side with their legs bent. For this video, we're going to be having the patient lying on their side with legs bent. So to palpate the ischial tuberosity, you will start in the midline of the buttock and go inferiorly until you find a bony prominence, just right here. To find the sciatic nerve, you will be going laterally from the ischial tuberosity, about right here. It is halfway in between the ischial tuberosity and the greater trochanter. Although you may not feel the nerve itself, some patients can feel tingling in the lower legs. To find the greater trochanter, you will go from the ischial tuberosity, you will go inferiorly and laterally in about a 45-degree angle until you find a bony prominence, and that is the greater trochanter.
So I'll be palpating the iliac crest. I'm going to find the patient's trunk area, which is about here, and then I'm moving a downward curvature, and that's where the iliac crest is located. Palpate the lumbar spinous process. You locate the iliac crest, and then in the midline of the back, where your thumbs are located right now, this is the L4 and L5 space, and this is where I palpate. After locating the L5 spinous, you move inferiorly, and that's where our sacral process is located.
To palpate the posterior superior iliac spine, also known as the PSIS, you locate the 2 dimples above the buttocks. Some patients will not have the 2 dimples, and above the 2 dimples, there will be a bony prominence, and this here will be the PSIS on the skin. Right here. Okay, that's good. Did you stop?